Orthodontic is the branch of dentistry that corrects teeth and jaws that are positioned improperly. A specialist in this field is called an orthodontist. Orthodontists receive 2 or more years of education beyond their 4 years in dental school in an ADA-approved orthodontic training program. How does orthodontic treatment work? Many different types of appliance, both fixed and removable, are used to help move teeth, retrain muscles, and affect the growth of the jaws. Fixed appliance is braces, and removable appliance is
Dental Public Health. The dental public health specialist is responsible for providing oral health care to the community through population-based strategies and community programs. The dental public health specialist is also responsible for oral health policy development, program management, oral health promotion, and oral disease prevention, as well as the safety and health aspects of the clinical environment.
What is restorative dentistry? It is the study, diagnosis, and integrated management of diseases of the teeth and their supporting practices. Also, the rehabilitation of dentition to functional and aesthetic requirements of the individual. What are the types of restorative dentistry? 1 is endodontic. It is a study and practice of the basic and clinical sciences of the biology of the normal dental pulp and the etiology, diagnosis, prevention, and treatment of diseases and injuries of the dental pulp, along with associated periodical conditions. A very famous endodontic treatment is the root canal treatment. Prosthodontics is an area of dentistry that focuses on dental procedures, or also the dental specialty pertaining to the diagnosis, treatment planning, rehabilitation, and maintenance of the oral function, adherence and health of patients, clinical conditions associated with missing or deficient teeth, or oral and maxillofacial tissue using biocompatible techniques. Common treatments would be veneers, dentures, and also oral implants. Periodontology is a specialized branch of dentistry involving gums and supporting tissues. It takes minimum 3 years to study this field, which is offered in some local universities including UKM, UNM, and UNM. Periodontists usually handle cases with severe gum disease which involve bleeding of gums and if left untreated, can result in teeth loosening and falling out. To solve this, periodontists perform non-surgical treatments, namely scaling and root canning, which the infected surface of the root is cleaned. For more serious cases, surgical treatments such as bone graft and flap surgery are performed. For bone graft, fragments of patient's synthetic or donated bone are installed, which replace bone that has been destroyed, which supports regrowth of bone to restore the stability of the tooth. For flap surgery, gums are lifted back to remove calculus and irregular surfaces are smoothed to deter bacterial buildup.
Oral medicine and pathology involves the diagnosis and non-surgical management of oral, maxillofacial, and temporomandibular joint diseases or disorders. Oral medicine specialists, they diagnose and treat conditions of the mouth and jaws. These include the oral mucosa diseases, neuromuscular dysfunction, temporomandibular joint pain, and orofacial pain disorders. People with complex medical conditions often require oral medicine specialists to manage their dental care. Oral pathologists, on the other hand, they diagnose and treat diseases affecting the oral mucosa. They perform laboratory procedures on an oral and maxillofacial tissues to establish a histopathological diagnosis. Oral pathologists are central to diagnosing both hard and soft tissue samples biopsied by dentists, surgeons, or physicians.